Sports injuries happen. Depending on how severe they are, they can stop someone from ever enjoying their sport again. In tonight's MedWatch, Michelle Dunaway shows you how surgery is helping a skier get back up after an ACL tear.
Feeling I get, it's like nothing else. You get to kind of all life's real problems or things that would, consume your daily life kind of disappear for a minute.
Skiing and snowboarding are passions for Darren Schulte, but after landing a jump wrong in Oregon, his escape took him somewhere he didn't want to be, the hospital.
Yeah, you can kind of feel it rip, which was kind of a crazy feeling. It's kind of hard to explain because it's kind of right in the middle of your knee all the way through it. So yeah, I definitely knew something was wrong.
Darren tore his anterior cruciate ligament, or ACL. Soon he was on his way back home to Traverse City to see Dr. Thomas O'Hagan.
It's about 10 millimeters wide, so about the width of a tube of chapstick, and it's about 1.5 inches long. It's a main stabilizer to the knee, and that it prevents the knee from shifting and pivoting.
Some people choose to do nothing after an injury like this, but Darren was not going to leave his extreme loves behind. So he opted to have the ligament rebuilt using another one of his tendons.
Which is very similar in the way that it's done in professional athletes. And we use that method because Darren's a very high demand athlete. He skis and does a lot of extreme sports that are going to really test his new ACL. And he's done well from it so far and is back to skiing.
But this didn't just happen overnight. He put in a lot of work to get to this point.
Yeah, I've done a lot. I've been going to the gym. I have my road bike on a trainer at my house. I pedal it around before I come skiing every day and after skiing, just to kind of, lube up the joint, break down the swelling. But really, with an ACL reconstruction, just like O'Hagan will say, it takes time no matter what you're doing.
Those are nice, when you have athletes who are really committed and dedicated to getting back and who work hard through rehab to do that, because their results often are better, that they put in the time afterwards to get back.
And because of the decisions and the work, chances are Darren will be skiing on his knee for a long, long time.
I talk to athletes about their short-term goals and long-term goals, and certainly as a physician it's important to take both into consideration with regard to his safety and how his knee will function. And his short-term goals are that we get him back to skiing at 100%, and his long-term goals for Darren is that we protect his knee in the long run. And the expectation will be that this new ACL will be the ligament that is in his knee forever, and that it will become his own tissue.
For 9 and 10 News MedWatch, I'm Michelle Dunaway.